Welcome to my next Q&A where we'll be talking with Lil about training through pregnancy. So let me just add her and we'll get started. So thanks for jumping on. How's it, Lil?
No, I got it right first time.
I was wondering if you got the hang of it by now.
Shit, I'm impressed.
I know, it's gonna hail.
It's been a hail. How you doing? What's happening?
Good in you.
Good, good, good. I'm
So,
pumped. I'm pumped to talk about the subject.
well, I know it's such a good topic to talk about because obviously I get a lot of inquiries
Yeah,
and no better time to do it while you're actually going through it. So,
I
um,
know. And I've worked with pregnant women for so many
yes.
years. Obviously, I've got the studies and the research behind it as to why I've been working with it. But to actually be going through it for the first time on my own does just put and give you like a whole different
Well,
perspective on it.
that's exactly what my first question was going to be. Is like before going through like the common questions that I get asked, I was going to say, well, having coached a lot of people and women through this over the last 15 years, what's it? My first question was, what's it like? How's it been for you going through it?
Well, I, I'm really happy to know that my protocols are effective.
Yeah, that's the most
But
important
it's,
thing. Eh?
yeah, it's now actually experiencing the frustration of how frustrating training can be. And we'll talk about it when we go through it because of the certain changes that you have to make.
Mm.
But it's been awesome. And I'm so grateful that I have a training background before falling pregnant because
Mm.
it definitely makes the whole process a hell of a lot
What
smoother.
have you found has been the most challenging while you've gone through this?
Training wise,
Yeah.
I think it's also just having more self control over what I'm able to do because I'm obviously one of those people who just is so gung ho on going hard,
Mm.
going fast, lifting the heaviest possible, and having to pull back and realize that it's not
Yeah.
about me. These 9 months are not about me. It's about this baby and doing the best thing for this baby to keep it
Yes.
safe, keep my body healthy. So that's what's been hard for me is actually pulling in the reins and knowing when to pull in the reins.
Yeah. But like when I saw you last week, I mean, if you stand straight on, you would never notice anything until you turn sideways and you think, geez, like you swallowed this beach ball. But
I know. You
you,
know what
you
my
can't even
mother said?
tell.
My mom was in New Zealand for 3 months, so she
Oh.
hadn't seen me. And she comes back and she looks at me and she says, "You look like a question mark."
Oh,
I've
no.
never heard that before. Yeah.
Um, yeah, but otherwise, yeah, geez, how long now?
About
3 more weeks.
2.5 weeks, 3 weeks
Oh,
on. So it comes quickly. It really, really does come quickly. I remember starting off this process and going, oh, I'm just going to carry on my training, carry on my life. Everything's going to be normal. And then suddenly carrying around this watermelon and life becomes really challenging.
and how have you found like people following your like journey through the pregnancy?
Everyone's been so super supportive. Like, obviously, in my position and in my role as a strength and conditioning coach, because I work with a lot of high level athletes, I thought that people may start to treat me or look at me differently as someone going through this maternal stage. But my athletes have been so super supportive. They obviously still have their full trust in me and my abilities. Nothing's really changed, but it is something that I was concerned about.
Well, obviously, you're not like because you've not never experienced it, so you're going into the unknown. So,
Yeah, 100%.
um, cool. I mean, obviously, the best place to start is a couple of the common questions that we get and people ask, women about training. So, I mean, the first one is the main one is like, is it safe to train during all three trimesters?
Yeah, absolutely. Look, it depends on whether you were training prior to falling
Yeah.
pregnant. I wouldn't recommend starting your training journey if you've never trained, done no resistance training, no exercise in the past. It's not the time to start because obviously you have to learn movement mechanics. You've got to understand your body, all these things. So I wouldn't recommend training through your pregnancy if you have zero training age beforehand.
Yeah.
So that's an absolute no. Otherwise, yes, you should be training through your pregnancy. I mean, I know a lot of women who are, they're runners, they're fit people, they go train, they become, huge fitness enthusiast, and suddenly they fall pregnant and they think, well, now I don't need to train.
Yeah.
Well, no, you absolutely should train because, like I said, it's not about you anymore, it's about your baby. And the benefits of training throughout your pregnancy, how your baby actually benefits from that, how it strengthens their heart, strengthens their lungs. You want all those things. You know, you want their developing bones to develop with a good density. And training affects all these things. And I think women often forget about how their baby in utero is actually benefiting from their
And,
training.
and I think it also comes from fear or lack of knowing or
Yeah,
knowledge.
and I
If they
think
don't know, then they would just rather do nothing.
I know a lot of people, some of our own athletes who've actually been told by their doctors, by their gynaes, that they should not train. And with all the research and all the evidence, and I mean that's quite an archaic approach. Yes, if you have a pre-existing condition, if there are complications, if there are issues, absolutely you must listen to your doctor. I'm not saying don't listen to your doctor. I'm just saying if you are perfectly healthy, you've been training, you should continue to train. There should be no limitations there.
And like what are the best exercises for pregnant women?
So, all right, let's just talk about like some of the things that you need to be wary of, and then some of the modifications that you should
Yeah.
be making, and then we can talk about some of the best exercises. So, firstly, one thing to be aware of is that when mom's heart rate goes up, baby's heart rate goes up exponentially. So, it's important, and this is what becomes difficult for people who are fit and who are strong to training, is you need to keep your heart rate below 140.
Mm.
So that means longer rest periods, managing this, managing your heart rate all the time because you don't want it to go over that. So it does slow you down. So training does take a little bit longer. It can be quite frustrating because your heart rate can go over that quickly, especially if you're into like endurance type training and, you know, that sort of thing. So you've got to maintain that. And then things to understand is, you know, especially in your first trimester is a very high risk period. This is when a lot of people can lose their babies. So it's important to just pull back the intensity, but get through that safe stage. Doesn't mean you need to modify your training in any way. You can continue the type of training that you've been doing. I would just say reduce the intensity somewhat, increase your rest periods, and most importantly, listen to your body.
Yeah.
You know your body, listen to it. You know, if you wake up on a day and you're feeling overly fatigued, don't go train if you're feeling fatigued because it's going to affect your technique. It's going to affect your output. So just listen to your body. Um, and then from the second and third trimester, obviously, as your uterus starts to grow and as that baby starts to grow, I don't recommend doing anything where you're lying on your back because it actually, the inferior vena cava, which is the main vein that travels from your lower body to your heart, obviously the blood pressure slows down. So you don't, again, this is about your
Yeah.
baby. So you don't, so generally with my programming, I'll avoid any, you know, bench pressing. I'll move up onto an incline. So you can still continue with the movement. You've just got to modify. Your joints also start to become more lax. So obviously because your hips are preparing, they're starting to move apart. Because you have that laxity in your joints, I will start eradicating like single leg movements, not for the safety of the baby, but because you are more lax, uh, you can be at risk of falling. And again, people are very afraid of like falling in the gym or something happening. We are absolute machines. And the way we are built is to protect that baby. So the biggest concern here when I'm saying this is that mom doesn't get
Yeah.
hurt. It's not that the baby's going to get hurt if you fall because you're doing a lunge and you drop onto your side. It's because you may potentially get hurt. You would have to throw yourself downstairs, get into a car accident, you know, major things like that is what's going to impact the placenta and the uterus. But for yourself, your joints are more lax. So I would start eliminating single leg movements just because of that factor. And then with regards to, you asked me the best movements. I always like to say compound movements because you're going to get bang for your buck. Things like the deadlift, the squat, the overhead press, those big movements, they're full body movements, so you're getting a lot more out of it. Your body also recovers faster. So when I build my training programs for a pregnant woman, I will always make every day a full body day. Because when you start isolating or doing like bodybuilding splits where you're doing upper body or lower body, your body takes longer to recover because those muscles are being hammered.
Yeah.
And your body needs to focus on everything else that's going on in it. And it needs to prioritize that over recovering your muscles. So compound movements, full body movements on a day-to-day basis.
Okay. Perfect. And how hard should they be pushing themselves? Like you said, it's the heart rate. It's like mainly.
Yeah, so heart rate's a major thing. So there was actually a major study done with pregnant women, and you can train to you can train between 70 and 90% of your max. So you're actually still able to train at a high intensity weight wise. Obviously, again, you're going to take longer recovery
Yeah.
between sets, but the fetal response showed that the heart rate stays in the normal range for a baby. The blood flow within the babies and the umbilical cord doesn't increase to a dangerous into a dangerous rate during heavy weightlifting. So again, those are just old school
Yeah.
wives'
Yeah.
tales. You know what I mean? The studies have been done, the research is there to
Yeah.
say that you can continue to lift. When I say pull back in, you're not going to go into 100% max effort attempt when you're in your
Yeah.
30th week of pregnancy, you know? You've got to, and
You.
also because you, yeah, because it's not recommended to wear belts and that
Yeah.
while you're training. So, you know, you're not going to be able to go over that 90% max anyway. So you've got to be careful. Like I said, you just listen to your body, you take it at your own pace. But don't be afraid to increase the weight slightly because you think it's going to affect the baby. Research and studies show that it does not.
And like core exercises, like ab exercises,
Yeah,
obviously you want to.
you absolutely can continue to do those things. Those things are actually really important because you need to strengthen those intrinsic core muscles to keep your pelvic floor strong. You know, there's a lot of pressure on your pelvic floor, and the stronger your pelvic floor, the better. So training your abs, or I don't like to say training abs,
Yeah.
but training your core it's also going to protect you from things like diastasis recti, which is a very, very common thing that pregnant women suffer from. And that's when the abdominals go down the center of your core. They actually split apart. So you've got this thick piece of fascia in between. And it's not a dangerous thing. It's not a bad thing. It's just hard to come back from once that starts to happen. And you want to avoid that happening during your pregnancy so that you don't have to deal with it afterwards. So things like pelvic floor training and strengthening your core, really important for avoiding that.
And like, how would they deal with fatigue, morning sickness, and staying consistent? I mean, I'm sure if you experienced that.
Yeah, absolutely. You know, the consistency is a big thing. I've been very fortunate because I haven't had any pregnancy symptoms. So I haven't suffered any morning sickness. I haven't suffered with any fatigue. Consistency for me is already a discipline. It's just something I do. But again, it's really important if you are experiencing that fatigue, you need to rest. Your body needs to recover. So take it. You know, even on the days that you don't feel like training, but you know that you can, go in and do something, even if it's 30 minutes. Your body and your baby's just going to benefit from it. So don't avoid it altogether. But again, if you are suffering from morning sickness or fatigue, it's just going to affect your training output. And if you're not going to be able to train at like 80 to 100%, then, you know, you can just land up getting injured. You're not focusing on your technique. So listen to your body, you know, go when you feel like you can go, but don't avoid it. Don't go because you're not feeling motivated.
Yeah.
Have a good reason not to go.
And will training help with labor and delivery?
So absolutely, you know, things like having a strong lower back.
I think you're on mute.
How did I mute myself?
I don't know. Maybe okay. I can hear you
Okay.
now.
It's really going to help you recover faster from labor. So whether you're having a C-section or a natural labor, if you've got a strong body and you've been training throughout your pregnancy, you're going to recover a hell of a lot faster. I don't like to say bounce back because you're not bouncing back from anything. You've just gone through the most incredible 9-month journey. You've brought life into this world. Your body's had to change to adapt to that. So we don't want to
Yeah.
bounce back, but you are going to recover faster and get back into the shape that you used to a lot faster if you've been training. So when they say it's going to help delivery and labor, it's more so the recovery.
And the question is, how do I train safely if I have pelvic floor issues or what's it, diastasis?
Diastasis recti. Yes, that's what I mentioned and spoke. So again, if you haven't trained in the past before, then this is no time to start training your
Yeah.
pelvic floor.
Yes.
You know, those sort of things are also what comes from a structured training plan. If you're working directly with a coach, you're following a structured plan, we will put things together that will ensure that those things are a big focus in your training plan to ensure that you're strengthening your pelvic floor. Because like I said, your uterus, I mean, I'm in week 36 now. I've got like 10 new kilos on my body forcing down on my pelvic floor. And if I didn't have a strong trunk and a strong pelvic floor, I can imagine the kinds of issues that I'd have to be dealing with. So it is really important that you do focus on those isolation movements.
And those are you've incorporated in the program on the app for.
Yeah, so I've built structured training programs for pregnant ladies throughout the trimester. Obviously, these are women with no pre-existing conditions, just want a good structured general plan. I've incorporated all these things into the training plans for them because I've been doing this for so many years with so many pregnant women, and now I'm going through it myself. That plan is like foolproof.
And because, I mean, like you said, I mean, obviously we work with people on a one-to-one basis. They want something a little bit more tailored. But if there's somebody that just wants something to follow, like you say, just on their,
Absolutely, absolutely. And everything is mentioned in that program. So, reminding the user to maintain that heart rate that I recommended, keeping up their cardiac fitness because cardio is really important during times like this. So I've really covered all the grounds of what you can be doing. I've changed things as the trimesters go to allow for, like I said, your increased ligament laxity and that sort of thing.
And in terms of the last question, like for you especially, like what is the game plan after giving birth? I mean, how soon can you return to training, or what like would somebody focus on first?
So this is also going to depend on what type of labor you've having. How intensive your labor is, whether you're having a C-section. C-section is generally a longer recovery because you're going for a full-on operation and you can't allow that wound to get infected. Your entire core has been cut open, like right through the muscle. So there's definitely a longer recovery. Um, with most people that I've worked with in the past, C-section moms can generally start training after 4 weeks. The doctor recommends 6. The reason I say 4 is because there's so much that you can do that doesn't put the core under stress. So we could start by doing those things. After you get that clearance from the doctor after 6 weeks, you slowly start to build up. I mean, I've had ladies after natural birth start as soon as 1 week after labor. So every case is different and every case is unique. The best thing to do is talk to your doctor or even just reach out to me, have a chat, tell me about your labor process, and we can talk and I can always make a recommendation.
And everybody asks for like a time, and again, that is also dependent on
Yeah. How long is
class.
a piece of string?
Exactly. So
It's
that's
it's
a
very
common,
dependent on the woman and her birth.
yeah. And yeah, I mean that's
Cool.
short and sweet. We just obviously is not, didn't want to cover too much because obviously you can go down to many different rabbit holes. But it's just to give people an idea that you can
Yeah.
pregnancy. Um, but what I'll do is I'll post this again afterwards so that people that have missed it can watch it, or if anyone's
Brilliant.
questions or comments, they can obviously pop them below and we can answer them. If they need any more help or got any questions for you. But otherwise, yeah, thanks for taking time to pop
Cool.
on and
Thanks, Tino. Awesome. Always good to have these live chats.
yeah,
And like I said, if anybody has questions regarding this, please just reach out. I'm always happy to answer questions.
cool.
Cool.
So yeah, thanks again, and we'll see you on Saturday for your baby shower.
Yay. Yeah, I'll see you then. Thanks so much, eh?
Cool.
Okay,
Ciao.
bye.
Bye.